Welcome to the North Manchester General Hospital's Women and Children's Unit. The Trust runs the Royal Oldham Hospital, Fairfield General Hospital, Rochdale Infirmary and North Manchester General Hospital. Maternity inpatient services are available at the Royal Oldham Hospital and North Manchester General Hospital. North Manchester General Hospital can be reached from the A576 Middleton Road or the A664 Rochdale Road. The hospital is situated on Delaunay's Road, which is in the Crumsall area. To find the hospital using a sat-nav, please enter the postcode M85RB. Please take a few moments to make yourself familiar with the parts of the hospital that you may be visiting during your pregnancy and during the birth of your child. You will have already discussed with your community midwife the best birthing options for you. This may be in your home, in the Bluebell Birth Centre, or on our consultant-led labour ward. Whatever your decision, we will support you throughout your pregnancy, birth and beyond. Supervisors of midwives are also on hand at the hospital to give advice. They can help if your needs are more complex and you would like to discuss your birthing options further. When you are at the point in your pregnancy when it is time to come to hospital to give birth, please phone ahead so that we are aware you will be arriving soon. You will have been given the relevant telephone numbers by your community midwife. In most cases, you will be advised to come directly to the maternity assessment unit. Please remember to bring your green maternity notes with you, as this contains information we will need at this stage of your pregnancy. North Manchester General Hospital is located on Delaunay's Road. This is the Women and Children's Unit. There are two separate 30-minute free drop-off zones which are close to this unit. Car Park 1 is the nearest place for longer stays. The antenatal clinic is located next to the Women and Children's building. The maternity assessment unit is here. Entering the hospital site from Delaunay's Road, take the first left towards the Women and Children's Unit. Use the drop-off zones for easy access to entrance 1. Car Park 1 is to the left across the drive from the entrance doors. Patient and visitor parking is available in areas with green signs. A pay and display system is in operation in all the car parks, so please make sure you obtain a valid ticket. The Women and Children's Unit is on 3 floors. Level 1 has the neonatal unit. Level 2 is the labour ward and Bluebell Birth Centre. The antenatal ward and postnatal ward are on Level 3. The antenatal clinic is located next to the Women and Children's Unit. The maternity assessment unit is in F block and can be reached on Level 2 through entrance 1. Enter the unit through entrance 1, which is on Level 1, and follow the corridor round to the left for the nearest lift and stairs. When staff have examined you and assessed your progress, you will either transfer to the antenatal ward, labour ward, birth centre, or you may be sent home. You should be aware that all of our wards in the unit operate an intercom and buzzer entry system. At the ward entrance, please wait if the intercom is not answered immediately, as staff may be busy with other patients. Please be careful as the doors will open towards you. Remember to use the hand gels provided, especially when entering the ward, as this helps to control the spread of infection. Staff will be ready to meet you and help get you settled in. The midwife-led Bluebell Birth Centre is designed for ladies who want to be more active during labour and who wish to return home soon after birth. Here, women with low-risk pregnancies are in control of the birthing process, supported by the midwives in the centre. The rooms include a number of options to help ease the final stages of labour. These include a rocking chair, birthing ball, grab bars, along with a sling and birthing couches. A birthing pool is also available for you to use. The room's lighting can be adjusted and you can play your own music. Alternatively, You may be admitted to the consultant-led labour ward, where you and your baby can receive continuous monitoring from the medical team. The hospital also has dedicated maternity theatres which are located in the unit should they be needed. Specialist staff and equipment are on hand in our neonatal unit should your baby need additional help during its early days. You may be advised to stay in hospital for a short time after giving birth. If this is the case, you will be transferred to the postnatal ward. Here, our staff will continue to offer support and advice if needed. Whilst in hospital, we help to ensure your baby's safety by fitting them with an electronic tag. If this becomes displaced or removed, staff will be alerted and the doors to the ward will lock. The doors to the lift and the stairs will also lock. Our midwives are keen to support skin-to-skin time between new mothers and their babies, and also encourage you to start breastfeeding. The postnatal ward also offers facilities for new mums to make their own snacks and drinks. Staff will try and ensure that your stay here is as short as possible so that you can start to care for your baby back at home. More details about the services available from Pennine Acute Hospitals, NHS Trust, plus information for visiting relatives will have been provided by your community midwife. Alternatively, it can be found on the Trust's website www.pat.nhs.uk. You can also follow us on Twitter.